All right, good afternoon, everybody. Today we're really going to focus on reopening Connecticut. On a weekly basis now, we're going to have our co-chair people of the Reopen Connecticut team help give us an update on what our strategy is to thoughtfully reopen the state. That's Ingenuity, leading on the corporate side, former head of Pepsi, and Dr. Albert Coe, one of the world's leading infectious disease experts. And they've got number of people in the business as well as on the scientific team that are helping advise this effort. And they're going to take the lead on this. But let me first just give you an update on where we are. I think the two numbers, again, that I usually focus on here, unfortunately, the fatality rate is not going up, but it's not going down. And that's not a leading indicator. The currently hospitalized is a good number again. Remember, we were going down, we went up a little bit down. The most important thing is the trend is down. What that means in terms of infections within the greater community, what that means in terms of our capacity at the hospitals is good news. You'll see why hospitalizations are down. It's no surprise that Fairfield and New Haven are flat and trending down. We've known that for a while. I think the good news here is Hartford. I mean, Hartford was ramping up, as you can tell, and that's where a lot of our hospitalizations are going, as the virus was heading north. And if we can continue this flattening of the curve in Hartford, that speaks volumes about where we're going as a state. I'd like to spend just a few minutes on this chart before handing over to Indra. But as you think about reopening the state in a thoughtful way, you think about the fact that we didn't close as much of the state as most of our peer states have done. You can see that first chart there says that about 38% of our total employees were closed, and about 62%, or almost two-thirds, stayed open. Obviously, we all know about the first responders. We know about the essential businesses, grocery, pharma. But we did some other things. We were a state that did not close down manufacturing, especially our defense-related manufacturing and everybody in the supply chain there, and the tens of thousands of jobs represented. We've worked very hard to keep those environments safe, making sure that we have more access to masks, which we talked about yesterday, getting the fever thermometers. But that's why, on a broad basis, we kept a lot more of our economy open than our peers. When I listened to, Texas saying, we're going to open up our state parks now, we never closed down our state parks or beaches. When I hear Michigan talking about, closing down gardening and landscaping, we never closed down gardening and landscaping. We said we have to do that being careful about social distancing and the rules we have, but we had big pieces of our economy we definitely kept going. Daycare, we always kept going as well. Our stores, we never closed them down, and even the non-essential, we said, you can continue, but just can't let people into the store. You can only do that by drop-offs and delivery. And we're rethinking what we want to do now in terms of those non-essential stores, ways that we can increase the number of employees who are working. You see as you move over in that chart that we have 62% of our employees, we never close those down. 76% of wages are reflected there. And that's in part because in the areas that were closed are fairly labor intensive, hospitality, bars, restaurants. That's about 150,000 employees. That's where a lot of the lost employment is coming from right now. And so I know it doesn't do good for me to say two-thirds of the economy is working if you're in the one-third of the economy that is not working. And we take that very seriously, and that's what we're really going to focus on. And secondly, or finally, you look at the unemployment, you'll see that most of the unemployment comes from that section of the economy, mainly in hospitalities, bars, restaurants that are closed. And that's what we have to think about in terms of how we're careful to get things open again. I will tell you that Indra and Alfred are being advised by some of the great minds in the state. I'm going to let Alfred tell you about the scientific minds, because I would not be able to do them justice in terms of what they're bringing to the table, in terms of data, what they're terming in life sciences and entrepreneurship, not to mention more broad-based about epidemiology and infectious diseases. We are fortunate to have the best minds in the country here in Connecticut advising us. Indra and I and David Lehman worked hard in terms of making sure that the business community and labor community were represented in the groups advising the reopening from a business side. And we really wanted to focus on the small businesses, and as you heard me say, those small businesses that were most impacted by the close down. So we get their best advice as we try and reopen. That's representatives of the lodging industry, the Restaurant Association, my friend Rodney Butler, and the tribes, because what's happened there in terms of the casinos. Obviously, the chambers of commerce and our friends in labor, just to make sure that people are kept safe as they get back to work. They are all going to be represented as part of what we try and do as we move forward towards our May 20 date. You know, Indra, you always tell me to set timelines and dates so people can focus on that. And that's what we tried to do here, that over the next few weeks, Indra, May 20th is the date I said we're not going to be opening any schools by. May 20th is the date that we hope we have more information on testing, more information on contact tracking, and more information in terms of the gowns and the protective gear, all of which will help inform how and when we get our economy open again. Indra, over to you.
Thank you, Governor, and it's a pleasure to work with Albert on this whole project. So thank you for involving us. Over the past few days since we talked to you last, we've been hard at work modeling the impact of the economic shutdown on the economy in Connecticut, and then figuring out how we can selectively reopen tranches of the economy. And the way we're approaching it is, think of it as a set of 4 gears. We are never, ever going to not focus on public health, because at the end of the day, we want to make sure every citizen in Connecticut is viewed as the most important citizen. So we are making sure, keeping public health issues in mind, how do we dial up the other 3 gears? How do we get the levers of business working again? How do we get colleges, universities, and schools back functioning later on this month or later on in May or in September, whenever we can? And then how do we protect our vulnerable through it all? That's the community support. We have several scenarios that we are pursuing for delayed opening, for opening in tranches, opening counties, or opening certain businesses. It's not a simple decision to just pick a scenario. For every scenario, we have to look at the public health consequences. We have to think about what testing is needed, what kind of hospital capacity, what kind of traffic moves between counties or areas of the state, so that if you decide to open one piece, we know what the consequences could be for an outbreak of infections. So the team is very focused on every element of operationalizing our plan. But at this point, what we're doing is developing a range of scenarios and figuring out how to really put some numbers behind it, suggest a sequencing to the governor so that we can make a decision before the May 20th date, when we have to come to you and really talk about what's our future in Connecticut over the next 3 or 4 months. So that's really what we're focused on. Again, as the governor mentioned, there are so many bright minds in Connecticut who basically said, I'm going to put my job on hold for 3 months and come and work on this advisory group. So we are very, very thankful to every one of them. And it's been a 24/7 labor of love, but it's been something that we've all enjoyed, and we all feel very, very committed to the state and wanting to reopen it with the public health gear very much in mind. So with that, let me turn it to Albert to talk about what we need to get done from a science perspective. So together we can talk about how we can sort of move these gears in a very judicious way. Over to you, Albert.
Thank you, Indra, and thank you, the governor, for this opportunity to really capture some of the work that, much of the work that we've been focusing on. As Indra said, the most important, objective or goal for this initial step of thinking about reopening Connecticut is really increasing the capacity for us to implement testing for the new coronavirus. And that's important for several reasons. The first one is that we need to have that capacity to detect transmission in the community so that we can safeguard the health of our population, our citizens. And I think importantly, testing is also an important intervention, the first step in intervention of how we're going to protect the critical and vulnerable citizens of our communities in the state of Connecticut. And then we need to also use testing to inform better decision making. And that's with respect to not only reopening our economy, but also our schools. So why is that important? What are the goals that we want to achieve in testing? And I'm going to summarize some of the work that we've been doing, as part of the advisory board. But the first thing is we need strategies to identify spread in the communities so we can inform the public health prevention and control measures that need to limit future outbreaks. And also, we've talked about this in the past, but this is a highly transmissible virus, and we're concerned about the reemergence or another surge crisis that we've had in the past. And we need robust detection systems and surveillance systems to help inform us and guide us. I think most importantly also is the importance of limiting hospitalizations and mortality. We need to prevent the surge that all of our hospitals went through in the last couple of months. Fortunately, we never went to surge crisis because of good planning, but we need to be careful, be prepared for this in the future. And testing is one of the mechanisms, that we can use to limit hospitalizations and mortality. The next is that I think this is most important is we've seen over the last several months the impact that the epidemic has had on the vulnerable populations, and particularly in underserved areas. And we also, in the same time, need to protect the vulnerable by protecting those who work with the vulnerable, those people who treat the vulnerable. And these are our healthcare workers, these are our nursing home care workers. And finally, we need to use this information to really adapt and optimize and provide the most effective types of interventions. And this is based on contact tracing, quarantine, isolation, but also, what are the places that we have to, have an uptake or promote use of face masks, increased social distancing or strong social distancing. So what are the populations and who do we test? So these are going to be, the first priority is identifying those people who are sick and who are ill, who have symptoms of COVID-19 in the community. These are the symptomatic individuals. And then the next priorities are those of people who actually, in order to protect our elderly, to protect the people in the hospitals and the nursing homes, we need to test intensively the healthcare workers, nursing home workers, to protect those, and as well as the other frontline workers that, in order to keep our state secure. And then finally, as we've seen play out in Bridgeport, we've seen it happen in New Haven as well as in Hartford, the high transmission in our underserved communities is an important challenge. And it's important because they may serve as reservoirs. They may serve as sources of transmission. And we need to, serve not only to protect those communities from the harm due to the coronavirus, but also to address the sources of transmission in these communities so that we can keep the general population safe. So with that, I'd like to hand it back to Indra for final comments on our strategies.
Unmute, please.
Unmute. So the most important thing is the business and the public health teams are working very well together. And Governor, I think the date, May 20th, that you gave us, we should be in a good position to give you a well thought through plan.
Well, thank you, Indra and Alfred. Let me take the privilege of asking the first question, because I know how important testing is. We talked a lot about the antibody testing. We talked about PCR testing with a nasal swab. I was interested to see that Phil Murphy, the governor of New Jersey, has just authorized the spit test, something that's been done out of a Rutgers University, something that sounds like could be more self-administered, so to speak, be done on a more regular basis. Is that a real possibility here in Connecticut?
Yes, Governor. That's actually, one of the, key research priorities that actually our lab or our group here at Yale New Haven Hospital has been doing. As you can imagine, one of the big problems with the traditional way of testing is we're using these swabs, which you have to put at the back of the throat. These swabs are first not only uncomfortable, but they also cause, they also are a concern because of transmission. You can imagine if you're putting a swab in the back of the throat, people are coughing, and the person who's actually administering that has to be in PPE and is at risk for transmission. The other problem is that these swabs are actually in short supply in the country, which has actually limited their ability to roll out testing. So using the saliva test, and this is work that we've actually just put online and is available for the country, is that you can use saliva or spit. And that's very, that not only makes everything easier and more safer, but you can imagine how we can decentralize and how we can have testing more widespread, not only in the hospitals and the outpatient clinics, but actually into the community. So, so this is an important development, and we hope that we'll be implementing it as, in our mass testing programs here in the state.
All right, thank you, Albert. Let me just say before we open this up for questions from the press, it's worth remembering a great journalist, Josh Kovner, who sadly passed away. I think everybody in the press community knew the man and the work he did, and we'll remember him.
Move on first to the Hartford Courant.
Dr. Coe, I was hoping you could quantify this for me and maybe look into the future a little bit. If Connecticut is near the height right now, and correct me if I'm wrong on that, would you say that we're about halfway through this, and should we expect the coming weeks to be similar to the past few weeks we've had?
Yeah, so I think at this point we have, I think as the governor had showed on that curve, we're appearing to enter the flat period of the curve. There's always, bouncing, there are always numbers can change from one day to another. So we have to, filter out the signal from the noise. But it does look, especially in Greenwich, in Fairfield County, and also in New Haven, that we're actually we're on the flat end of the curve. We hope that's the case in Hartford. Now, the question is that how long, and how long will that curve last? I think it's fair to say, our experience parallels that of New York. Of course, they've had a much larger curve and a much more devastating outbreak in comparison to what we've experienced. I think it's fair to say we're probably about 2 to 3 weeks, 2 weeks behind them. But those are all rough estimates, and we really need to see where the data is going to bring us.
And also, Governor, you mentioned very, very briefly yesterday about Mitch McConnell's comments on the so-called blue state bailouts. How uncertain would you say that federal money coming to Connecticut is, or are you fairly convinced of how much the state will be getting?
Well, first of all, when it comes to blue state bailout, I think you should take a look at Senator McConnell's home state of Kentucky and look at their unfunded liability and look at the distress he's putting those people through. There's no way we're going to be able to get this economy moving again if you have states across the country forced to slash services and raise taxes. I think we're in a relatively better position thanks to our rainy day fund, but that's not unlimited, and depending on how fast we can get our economy back going again, we could be at some risk as well. So I would urge him to take a second look at what he's doing. Right now, the money we get from the feds reimburses us for COVID-related expenses, for which we're very thankful. And that we can pass along to our municipalities and towns as well, because they get that same protection, up to our limit. But the other 80% of our shortfall is related to revenues that have just disappeared, as we've talked about before. And I think that it's important that the Fed step up, at least for the near term, to make sure that states can get over that hump.
Thank you.
CT News Junkie.
Thanks. Governor, there are about 45,000 intellectually, developmentally disabled individuals who live at home with their parents. And I'm wondering if you are close to deciding whether to sign an executive order to allow their parents to accompany them to the hospital.
Yeah, let me think about that. It obviously makes good intuitive sense to me, and I'm not quite sure what that prohibition would be. So let me report back to you on that, Christine.
Okay. And what's going on with PPE? I know we had received a shipment earlier this week. Have we received any more shipments?
Yeah, I think there's good news there, Josh.
Yeah, it's continued to come in. We've gotten some good deliveries in the last 24 hours. We got a shipment actually earlier today of 2 million additional surgical masks. We've made about 20 deliveries out to different state agencies and other nursing homes and other groups that were in need. So the situation there is improving. And
testing was up yesterday, but testing seems to be a little bit down again or closer to the average. Is testing going to ramp back up, or are we short on materials there too?
No, it is lumpy because sometimes we get results from some of the out-of-state labs in big batches, and so it's really best to look at that on kind of a 3 or 4 day kind of rolling average.
Okay, thanks.
We're going to show you good news on that, Christine, over the next 10 days.
Boceto Media.
Good afternoon. Governor Lamont, the undocumented immigrant community has been asking for humanitarian help from part of the state of Connecticut as they don't qualify for federal benefits. They have started to raise their voices and other activist groups are joining. Is your office planning to give some type of help to this community? If so, when? My second question is, there are many people who apply for unemployment benefits that still haven't received their checks. Do you have any information of when they will receive this money? Does the state of Connecticut have the immediately funds to give this money to the families? Thank you so much.
We do have the funds for the unemployment checks. I would say that 85–90% of the checks for the traditional unemployment, those who lost their jobs with a major employer, they are getting paid. Those checks are being deposited or automatically deposited. There are some duplicates, there's some that didn't process, and there are a number of independent contractors, freelancers, and those are the ones that are going to take at least another week because that's a brand new program, as we've described before. And for the undocumented, what we have done is made sure that you can't get evicted from wherever you're living. Make sure that if you had health insurance, it can't be canceled. Make sure that you get testing. Make sure that you would get treatment for anything related to COVID at absolutely no cost. Make sure that ICE and others will not be there to interfere in any way if you feel like you have to go to a clinic or a health facility. We want everybody to be healthy, all of our people to be healthy, and make sure we have as few people as possible infected out there in the greater community. That's in the interest of all of us.
Hearst, Connecticut Media.
Thanks, Max. I've got a question for Dr. Coe, please.
Yes.
Sir, the latest report on hydroxychloroquine was, I guess, a VA study, and it seems that the results were mostly negative. Last week, I had talked to Yale physicians and physicians at Bridgeport Hospital who were using it as a combination with other therapies for patients. Is that issue becoming clearer to you? One of the pharmacy companies gave us 400,000 tablets of that stuff this month.
Yeah, I can comment on that. So I think, first of all, with current medical knowledge, we don't have evidence for the effectiveness of hydroxychloroquine on outcomes, or what we call, on whether patients live or die or whether patients could progress to, or protected against progression from, getting severe complications. That's at this moment. And that's really the importance. And I think, coming from the medical, research, side of things, evidence is really important. If we don't have high rigorous evidence, we can have patients taking unsafe medications or unsafe therapies and actually having bad outcomes because of safety issues without, a demonstration of effectiveness. So drugs like hydroxychloroquine need to be evaluated in rigorous clinical trials with good what we call study designs, where we can get actually the highest quality of information. Those studies are being done, but we don't have evidence from them at this moment.
So do you recommend that physicians hold off using it now? Or is it still going to be up to them?
So I think, much of decision making in medicine is very personal, depending on the physician. But my own personal recommendation is not to use it. And let's wait to see until we get the good clinical evidence. And I think that's important for a disease like hydroxychloroquine. It's not a drug that doesn't have, potential adverse reactions like arrhythmias. So I think we really want to, before we make uniform recommendations, we really want to have the evidence in place.
Thanks. And Governor, could I ask you, Governor Cuomo today was talking about the amount of money that New York sends to Washington that does not come back, and New York being a net giver as opposed to the state of Kentucky. Have you had a chance to calculate how much extra the state gives to the feds over what it gets back?
We've looked at it. It's about $7 to $8 billion. We pay a lot of income tax that goes down to Washington, D.C., and that's the net shortfall between what we send down there and what we get back. We are definitely a donor state. And that's remarkable, Ken, when you realize up until recently, we averaged about $1 trillion deficit. $1 trillion deficit. I mean, if we had our share of that, that would be tens of billions of dollars. So that just gives you an idea of the disconnect between how much Kentucky gets and how much Connecticut doesn't get.
And Governor, thanks for remembering Josh, and we appreciate it. Thanks, Max.
Connecticut Public Media. Connecticut Public Media. NBC Connecticut.
Yes, when it comes to how much testing is enough, I know that a lot of experts have said you want a low percentage of your tests to come back positive, around 10%, maybe even lower. We are not there yet. So without those types of pieces in place, how do we implement a reopen plan?
Did you hear that question, Dr. Coe?
Yes, I heard the question. Thank you for that question. And that's an important one because it really strikes at the heart of what we're going to be proposing and what we're planning for the advisory board. So we need to increase testing in order to decrease that proportion of all tests that are positive. Now, why do we want to do that? We want to make sure that we're testing widely enough so we can capture all the people who have been infected with COVID virus. If we don't test widely enough, we're never going to get that whole slice of the pie. So what is the ideal number? So at this point, the state is roughly, of all the tests that are being sent out, it's roughly about 30%. It changes from day to day, but at this point, it's around 30%. We do want it below 10%. And so that is a good number that you've asked for. And that ensures that we can actually capture everybody who's infected, who comes in with symptoms with COVID virus. The question is now, how do we get to that? And I think we've put some pieces to that puzzle together. We've actually taken the best institutions in the state in order to ramp up that capacity. And now we're getting the plan together, not only to have that testing capacity there, but also the supply chain to secure those numbers.
And Governor, on your end, what are you doing to try and continue to increase testing? Because I know some states are having to go, outside the country, South Korea, to try and buy these tests.
We're working with strong corporate partners. I think you were watched a couple days ago where the CEO of Quest came and their partnership with Hartford Healthcare. And they have a supply chain. They're an amazing asset for us. Thank goodness he grew up in Torrington, Connecticut. We also have a good, strong relationship with CVS, and CVS and Abbott Labs have their own continuing supply chain there. Jackson Labs, we're talking to every day about how fast they'll be able to ramp up. So when it comes to the supply chain for the necessary ingredients you need, be it swabs, be it reagents, we're working with strong corporate partners to make sure we get to the front of the line there.
For Reopen Connecticut, is there any indication on when restrictions can begin to loosen? I know that you want to have a plan by May 20th. I'm guessing it wouldn't be implemented immediately. I know there are other factors that come into play, but can you give us a ballpark? Could it be a June, a July that they begin to loosen?
Could you hear that, Indra?
What we'll do is we'll present the plan to the governor with the priorities. I suspect that loosening in tranches, again, very carefully in small steps so that our testing can keep pace with the loosening. We'll start sometime in June and then keep progressing through the end of the year.
Okay, and then one last question, if you don't mind, for the Reopen Connecticut team. Have there been discussions with the larger task force with the other states, and how has that gone, and how much of their decisions and plans impact ours?
So we have regular calls with representatives from the 5 other states. We had one call yesterday, and we all share information on what each of us is doing. Some of them would observe that Connecticut is probably approaching it in the most integrated way, looking at public health, the community, colleges and universities and schools and business all together as one integrated whole. But all the other states are also working hard at figuring out how best to reopen their economies, keeping public health in mind. We're all talking about testing. We're all talking about tracking and tracing. So the playbook is the same. The question is the magnitude of implementation and how soon we want to go. That's really the discussion we're having. And believe me, the unknowns that we're facing from an epidemiological perspective, they're facing too. So we're all learning from each other as we go along.
Waterbury, Republican American.
Thank you, Max. I have another question for Indra Nooyi. The governor has said earlier this week that he sees this, I guess he can tell you there, he's there, but I believe he said he favors a sort of statewide approach to reopening businesses, although with older workers, they may have to wait a little longer to get back. I'm just wondering, what's your thoughts? What's the discussion among your group?
No, we're looking at all these scenarios because at this point, we want to make sure that whatever scenario we implement allows us to protect the vulnerable, at the same time, open big pieces of the economy. So it could be by geography, it could be by business, it could be, a statewide slow ramp up. Every one of these we are modeling out as we speak. Again, as I said, it's a function of how can we contain the outbreak of the virus again if we open a county. For example, we looked at infection rates in Tolland, Windham, and New London counties. Again, low levels of infection rate. But if we open them up, how do you make sure nobody else from any other county goes in there and carries the virus with them and causes an outbreak? So we have to be very careful. It's not just Connecticut. For 2 of the counties, we have to worry about Rhode Island. The good news is it's rural. But for one of the counties, we have to worry about Massachusetts. So, and those are, heavily populated areas of Massachusetts that touch that county. So in every case, we have to think about traffic patterns, who goes in and out, what's the age of the people that go in and out, because if people are going to be carrying the virus without and being asymptomatic, that's even more dangerous because they're going to spread it to people in those counties. So each of these requires such careful thought and modeling. So ultimately, when we come to the governor, we're going to show him all the trade-offs with each of these scenarios so that together we can develop a sensible plan for Connecticut. So I would say next 2 to 3 weeks, just hang in there. We'll be back to you.
Okay. Dr. Koh, what level of diagnostic and antibody testing will be required to safely reopen Connecticut? We heard some discussion about that yesterday.
Yeah, thank you for that question. So I think just to be clear, so why are serologic or antibody testing is important? So this is an important public health tool. It tells us, when somebody has antibodies, it tells that they've been infected in the past. And by doing surveys in a population, we can use that as a tool to identify where the infection has occurred, who is susceptible and may get infected in the future. And also it tells us where we should focus our public health interventions. And these are going to be the ABCs, which are going to be testing, tracing, and isolation and quarantine. And so that provides very important information, as a public health weapon. And that's something that's integrated into the plan that we're developing.
Yes, but can you give people an idea of how much testing is going to be required? How many people in this population of 3.5 million are going to have to be tested on a regular basis? We have a workforce of about 1.6 million.
Right. So let me go back. So again, this information that's given is going to help us understand what's happening in the population. It's not going to give us information for the individual. For example, we can tell from the individual that they've been infected, but it doesn't, as far as we have evidence at this point, doesn't tell that the person's necessarily immune, okay, or they can't get the disease at this point. We believe and hope that would be the case, but at this point we don't know. So in terms of testing people, when we're doing these type of surveys, we don't have to do every single person in Connecticut. We can do a sample of them, and it gives us a snapshot about what happens, a representative snapshot of what happens over the state. So I think in those sense, and we're going to be coming up with those numbers, but that's information that's valuable for the community and the population, but it's not necessarily tells us what that specific individual has to do or should or should not do at this point.
We'll move along next to the Connecticut Mirror.
Governor Senator Fasano today raised the issue of what's going to happen in July with the raises that are currently due state employees. What's your intention in that regard?
A couple of things. We have amazing frontline state workers who are putting it out every day, be it in corrections in an area where there's infection, be it nurses, be it daycare, be it folks with disabilities, all the questions you've heard about today. So first of all, that's where my heart goes out to. I also understand the fact that I look around the state of Connecticut, I see people are losing their jobs, taking pay cuts, and this hits a note with people. So it's something I've got to think about seriously in terms of trying to get that right balance there, and I am going to think about that.
Is that something that you believe is within your discretion under the emergency powers, or would you need either legislative approval, but since those were legislative approved contracts, or possibly negotiation with CBAC?
Let me report back to you on that, Paz. I think these are things that we're thinking about. First, I want to sit down with our folks representing the state employees and say, look what's going on around the state of Connecticut. We're going to be showing that what we're going to do is the right thing as well.
Thank you.
Fox 61.
Nia Maldonado, Fox 61. Indra, I know NBC asked a similar question, but could you clarify, May 20th is not going to be a reopen date. It's going to be the date that you guys present a plan on how we can reopen?
That is correct.
Okay. And then, Dr. Koh, what's the latest on launching mass antibody testing? Is there a time frame?
Right. So I think this is related to the question that was raised previously. Those are things that we're coming up as we're at a plan. to integrate antibody testing to understand about who has been infected and who hasn't been infected in the state. And that information is going to help us identify how we best can roll out the PCR or the molecular testing that we talked about. That, we're going to be doing, we're going to be working down a plan, and we'll report back to you. And once we get the numbers, once we know how many people should be tested. Again, I think I want to reemphasize, this is not a test where every person in Connecticut needs to be tested. We can get the same answer by testing a smaller number, a representative sample of the population. But that is a priority on our list, and we'll be coming back to you with actually very specifics about how we're going to do that and how we're going to use that information to help us understand where we need to roll out the molecular detection or the PCR tests that are being currently done for identifying who's sick or who's infected with the COVID virus.
And Indra, you said we should start opening up in June, and the biggest challenge is how to prevent an outbreak. Is there any other country hit earlier than the U.S. that has done a good job with this challenge that the board is looking at?
We're actually looking at every country around the world that was infected with the COVID, went into a lockdown, came out of it, and how did they open up pieces of the economy? And if they had a second surge, what did they do and why did they have it? So we have a whole range of countries, and we're looking at it by business, for education, for the communities. We're looking at all of that. To be honest, there isn't a clear playbook that has emerged. What we're doing is learning what not to do. So again, give us a little bit of time to sort through all of this. This is a complex subject with lots of unknowns, but each of these has got a lot of interconnectedness. So let us work through this and be back to you in a couple of 3 weeks, and I think everything will start to get much clearer.
Reminder to all reporters on the line, please mute your devices. Once again, please mute your devices. The Day of New London.
Hi, it was mentioned earlier that one of the priorities for testing will be healthcare workers and nursing home employees, but the state is really not tracking whether these people are infected, correct?
At current, if somebody has a positive test, those are being tracked by the state. So, because it's a mandatory reportable disease. And so, those people are being, healthcare workers, or whether they're healthcare workers or they're people in the police force or the firemen who are sick and get tested, they're being tracked and they're going into the electronic database.
Right, but we don't know about them as a population sort of separately. They're just kind of going into the total numbers, correct?
Right, they're going into the total numbers. And actually that number is there. I don't have that at this moment, but I think the bigger question is that, this is a virus that, probably the large majority, or actually the majority of infections don't cause symptoms. And that's what we really worry about. And I think getting back on why we're worried about healthcare workers, why we're worried about nursing home workers, is that's how infections are being brought into these vulnerable sites, vulnerable settings, and vulnerable populations. And what we need to do is actually go beyond just identifying symptoms. But we have to actually actively screen these populations. I think we've seen, and this is played out in our state, but in other states, in New York, throughout the country, that in nursing homes, we have violent epidemics that occur. Once it's introduced into that setting, these not only cause a lot of infections and disease, but also cause a fair number of deaths, a large number of deaths. So I think the idea here is that we have to raise the bar up in terms of how we're going to protect the residents of nursing homes, as well as the vulnerable, the people who have comorbidities or have multiple medical conditions that are in our hospitals.
Thank you. And then either for the governor or Josh, I think you guys mentioned every Thursday the data was going to include sort of more information on nursing homes. It doesn't look like that's the case today, unless I'm missing it. Is that still the plan?
It is. The team is still working to scrub that data. As described previously, it's an incredibly manual process. They're still hoping to get that out tonight. Worst case, first thing tomorrow. Meanwhile, though, I should point out that same team at our public health department is out in the field. They've now completed 115 site visits to our nursing homes, inspecting their infection control procedures, helping to coach the teams where needed on the right way to contain spread in the nursing homes. Our surge capacity with our alternate care sites is also continuing to ramp up. We've now got over 700 beds in the pipeline with over 100 patients already placed there. And the other thing that is worth mentioning on this topic, or a related topic, is the governor is going to be issuing an executive order today to include assisted living facilities as the entities that need to report to the state with regards to their infections and other issues. And so we're going to be able to provide more insights there and also provide more supports to that set of very important service providers.
Thanks. And just last question, it's more of a federal question, but wondering if you guys could shed light on it. We've heard from some nursing home employees who have been infected, who are being told by their jobs that they have to use sick time while they're out. Our understanding was that the CARES Act provided 2 weeks of leave time that the federal government would then reimburse employers for. Have you guys heard about this issue, or can you shed any light on this?
Haven't heard that concern, but they should bring those issues to our attention and we can look into them.
The CARE Act definitely provides a 2 week of paid sick time, and contact Department of Labor if you're not being treated right.
Thank you.
Channel 3 Eyewitness News. Channel 3 Eyewitness News. News 8.
Governor, it's been widely reported that Abbott Labs, the 1-minute test, the 15-minute tests, have been inaccurate, the most inaccurate of all the tests, as much as 10, maybe 12% inaccuracy. Where are you using them? Have you talked to Abbott Labs about it, and have you found out more about this?
You should probably direct that to Dr. Koh, the question about the Abbott Labs test. I can tell you there have been inaccuracies in many cases where you have you can have a false negative, in which case they often want to do a second test just to double check on that. Dr. Koh?
Yes, so I think, so first of all, I think we have to kind of understand what the test is. So the test is, where many times you have to put a swab at the back of your throat. This is what we call a nasopharyngeal swab. And then you have to kind of twirl it around so you can get the cells that are infected with the virus. And then you take that out and then you put that in the test. And just that process is very user dependent. If one person doesn't stick it in, far enough, you get if one person doesn't stick it in far enough, you can get what we call a false negative, that the person's actually sick, but you get a negative result. And that's actually not necessarily a product of the exact test, but it's more a product of the way that we get the sample, and that affects the sensitivity. So we're not picking up or detecting everyone who's infected. So that's part of the sampling process. I think I'm not aware specifically, and I am not aware of anything published at this point about the inaccuracies that may be associated with actually the apparatus, the molecular detection setting. It is a different format than the tests that we typically use in the hospitals, which are what we call a PCR test. And so there may be differences in the performance, but at this point, we don't know. We actually have a team, as part of the advisory network with Charles Lee, who's the director of Jackson Labs, who's actually one of the foremost researchers in the country. And, they're evaluating all the performance of these tests and going through the evidence that's available.
Because these are being used for the front lines to return medical workers back. So if you're returning a medical worker who's positive back, is this something that needs to be looked in further?
Yeah, so I think this is certainly we're going to need, in order to defeat this virus, we're going to have good testing linked with good interventions. And the testing is going to have to be based on best practices, or the best new technologies, better technologies. And I think the governor referred to the work that our group is doing, a new test to look at saliva, which may be more reproducible in terms of getting the samples. You can imagine how this is not as user dependent, because all you have to do is just give a piece of a sample of spit or saliva, which is much easier and much more reproducible than having to do the swab at the back of the throat. So those are the types of priorities that we need to do in order to roll out, a widely disseminated, widespread community intervention, and those are the types of innovation that we're going to have to do. And just following up, the saliva is, I think, one of the promising things that we're actually drilling down in this moment and considering whether we should do this as widespread testing.
Moving on next to.
And we just heard that. Oh, I just have one follow-up about. We just heard that May 20th is the date you're looking at, but June may be when you actually start loosening. That seems like a long period. I know we don't want to reopen back, but then you said to the rest of the year. Could you just kind of clarify? I think that's going to. We got a lot of texts from people saying, "What? Is there a way to kind of clarify that?" So you're not looking maybe to loosen by the beginning of June, possibly the earliest, or would it be earlier?
I mean, again, as I said, we're going to present the plan to the governor. The governor will look at all of the options and decide what's best for Connecticut. We're going to give him our recommendations. I think that anything we look at in the plan suggests that a big bang opening in one shot in June seems unlikely at this point. But, we'll do all the analysis. So a big bang opening across Connecticut, I don't know. What we are modeling out is, if we can't do the big bang opening, how do we layer in pieces of Connecticut that can be opened, and can we actually control those pieces so that there isn't another outbreak? So again, as I said, these are very complex issues which involve human life. So give us time to model these out, present it to the governor, look at the options, and then come back to you.
Thank you.
Channel 3 Eyewitness News. Associated Press.
Thank you, Max. Good afternoon, everyone. Governor, does the state have enough money or anticipate receiving enough federal funds to do what's necessary to ease the stay-at-home orders? And also, do you plan on using all of the money from the CARES Act? I know there are some states that have complained about the restrictions and that they may have to actually send some of the money back to the federal government.
Well, the first tranche of money that we're receiving, about 1.35, 1.4, reimburses us for COVID-related expenses. This next tranche that they're voting on, probably as we speak, Sue, includes money for testing. So I think we're not going to be shortchanged in terms of doing everything we need to do in order to get this state reopening again. In terms of our lost revenues, that's a different story. Thank God for the rainy day fund.
And why are prisoners still being kept in dormitory settings, as we understand it?
Well, I don't know if that's, what I can tell you is we've had probably 1,000 plus fewer folks incarcerated today than just a month ago. And we're doing that on a very thoughtful basis. And I was on the phone with the clergy just the other day saying, we want to get more of those older prisoners out, those who are most at risk, and those are at least risk to the greater society. But we need to find a safe place that they'll be able to go to, a place that they can be taken care of. So that's what we're working on every day to reduce that load. In terms of the dormitory settings, I'd like to think that's minimized. We have a lot of extra capacity in our correctional facilities, so we can get people quarantined in best way possible.
I also think
and
it's
one
worth,
more
worth
quick
noting
one.
that while we've had 344 inmates test positive since this has started, and many of them have been cohorted at Northern, 162 of them have now recovered and been returned back to where they came from. So that's a great sign as well.
Thank you for that, Josh. And just one more quick one. Is there any progress with the talks with New York and New Jersey regarding the Bloomberg Foundation contact tracing?
I'm going to let probably Dr. Coe and Indra help take the lead on that. Josh has reached out. We're having some preliminary conversations right now. Give us a couple more days and I can get to you on that.
I think Josh should take that because he's been really involved in it.
I'm sorry.
We're going to get back to him on the Bloomberg Foundation in a couple of days.
Okay. And thank you for your remarks earlier, Governor. Thank you.
WTIC 1080 News.
Hi, is there an update on hotels? I know that in an executive order, they had been sort of, I don't want to say commandeered, but they're being used for healthcare workers and homeless and so on. Are hotels available to the general public now, or is that something to come with reopening?
That's something that's going to be later. Right now, we prioritize, as you said, for first responders, homeless. One of the things we didn't want is a lot of short-term rentals and hotels where people are driving up from New York, coming down from Boston, and here. We're trying to keep the stay-at-home as best we can. That includes, long-term visitors to our state. That could change over the next month or so, and we will revisit that. It's one of the things, Indra and Dr. Koh are going to help us with as we think about the reopening. Let me just say, in conclusion, a couple of things. We're talking about opening up businesses, getting back to work, the finances of the state and individuals. I also want to remember all of our frontline employees, those that are out there every day, food service, janitors, obviously nurses, doctors. Public safety, public health has a new meaning. I was just reminded that it was 33 years ago today that Lamont Plaza collapsed. It was one of the largest building collapses in the history of the state of Connecticut. I think there were 28 workers that died. So the challenges we have to keep our folks on the front line safe change with every generation, but it's just worth remembering that. And 12 years before that, or a little more than that, was the 50th anniversary of Earth Day. We just remembered and celebrated. And back then it was maybe clean air, clean water. Today, 50 years later, we're trying to deal with the effects of rising tides as we reinforce our coastal communities. And maybe pandemics like this are part and parcel of a climate that's slowly warming. And that's why we have a new generation of leaders and scientific leaders who help us deal with these challenges as they come and confront us. And I cannot thank Ingenuity and Dr. Koh enough. The team you have put together, selfless. This is the best of the public-private partnerships we can ask for, and this is how we get through it. And that's why Connecticut's going to be the leader in getting us through this safely. Thanks, everybody.